Breast Cancer Awareness, proudly brought to you by Parkview Health.
And for this segment, I'm joined by Dr. Melanie Clark with Parkview Health, and she's here to talk a little bit about screenings, why it's so important, and how the access to screenings is improving. Can you talk a little bit about that for us?
Yeah, absolutely. Thank you for having me. It's actually very easy to get screened even here in our local community. So most women would get screened through their primary doctor or their gynecologist, which are very reasonable ways to do it. We also are very fortunate in the Fort Wayne community to have Francine Friend's mobile mammogram. So some women have difficulties leaving work on time or perhaps can't get to the doctor to get an order. And that's a way to sort of bring screening more locally and even to communities or to local businesses.
And how does that improving access and the amount of screenings, how does that improve health outcomes?
Yeah, wonderful question. So most breast cancers that are early in diagnosis, so smaller without lymph nodes involved, are very curable. And so the sooner that we can find things on mammogram, then the sooner we can detect things before they become symptomatic or have spread.
Is there anything else that you feel is important that people should know about this topic?
I think it's also important to remember that every screening guideline should be individualized. So certainly we have guidelines, for example, starting around the age of 40, but if a woman is at higher risk due to family history or a man or a known genetic mutation, always want to get with your family doctor or your gynecologist early and talk about if that's the right screening for you. Should you be doing more screening? Should it start earlier, et cetera?
For general, though, is it just one screening recommended a year during the yearly checkup? Or?
Yes, for the most part, it's a screening mammogram every year starting around the age of 40.